When is a spinal problem an emergency? If you're a patient, when do you go to the emergency room?
Seems like you would always want to go to the emergency room. And I guess I would counter that by when would you not go to the emergency room?
Yeah. I think as a patient, some things to consider are you rapidly declining? I think that's one of the big ones. Pain can be a really big indicator, but is it associated with neurological deficits, meaning severe weakness or poor coordination? Things like that are indicators that this is maybe a more serious problem that would require an emergency room visit as well.
Mm-hmm. Yeah, it's commonly, I guess what we hear from patients are, my pain is out of control. Mm-hmm. The medications aren't helping. I just had a recent injection and I feel like every day the pain's getting worse and I'm not sleeping at night. You feel like that's a reasonable reason to get to the emergency room?
Oh, pain's a tricky one because I think a lot of the conditions patients are dealing with and some of the emergent conditions start with pain.
Yeah.
And so it's where does the boundary of this is a normal pain that's safe to work through or this is truly an emergency. And that's, I think, the trickiest thing to determine.
It's the most expensive medicine that's provided is in the emergency room. So there's that. Emergency rooms are crowded, and it can be an entire day ordeal to go. And yet, if it's a true emergency, it should be treated and identified and worked up urgently. So it's a challenge for patients to know, and for us as providers to know when to send a patient to the emergency room. So another follow-up question is, if a patient goes to the emergency room, what problems are the emergency room doctors going to look for that are true spinal emergencies?
Yeah, the stuff we talked about today was infection. I think that's always a big one because left untreated, that can get really out of hand and cause some real significant problems. And then the irreversible neurologic damage. So somebody showing acute and progressive neurological decline, drop foot, incontinence, and those types of progressive dysfunctions, I think are very, very appropriate to be treated emergently. And the trauma. If somebody's had an acute accident, an injury, it's worth looking at to make sure that it's a stable injury before you get into what would be appropriate care.
Yeah, I would agree. And I think a lot of those are spine focused. There's also the brain component. I think a lot of patients worry about brain component as well. I think often I get more patients going to the emergency department for concerns about something going on in their brain than their spine. And so looking for stroke, tumor, those types of things as well.
Yeah. I agree. So infection is a big one. Spinal trauma. We've had patients that have had falls and other kinds of accidents that didn't immediately go to the emergency room, but later went. Others that went immediately. Trauma's a big one. Infection's a big one. Acute disc herniations that's affecting the cauda equina or the spinal cord, causing potential neurologic damage that's potentially irreversible. So that's what the emergency room doctors are going to be looking for. The majority of patients don't actually have those problems. So if you're a patient, you go to the emergency room and they do an MRI, they do some blood work, and they call the neurosurgeon, and then they come back to you and they say, yep, we're going to have you follow up in clinic. It seems a little bit deflating. And I think patients run into that situation all the time where they're like, but you didn't do anything. And so the rationale is they ruled out the things that need emergent treatment. And so it sort of highlights the need to have relationships in the community with people in the outpatient setting that can manage and treat things in an ongoing basis. But emergency room care is something that is available in our society. It's a good thing, and it's always a question in the setting of acute pain, worsening neurologic deficit. Does a patient go to the emergency room, get checked out, make sure it's nothing bad, and then follow up with your provider for some ongoing management?
Yeah, what I thought was interesting too is so that patients can understand the other side of the coin is from the provider standpoint. You showed a lot of cases today of acute infections. There were a wide variety of different types of providers in the room. And I think there were probably varying opinions on which ones would have been sent to the ER and which ones would not have. It's not an easy answer.
It's not. No. If your doctor sends you to the emergency room and you really didn't need to go, don't fault them for that. Because it's hard to know. You don't have all the data in front of you when you're in the clinic, and you can't draw labs emergently. You can't get an MRI right away, and you're worried about something. That's a good point, that we don't know until we know.
And that's one of the biggest challenges, and I think frustrations for patients is sometimes clinic or getting into a provider is 3-4 weeks out, and they're struggling with this severe pain that they don't know, is this emergent or is this something I should manage on my own?
Yeah, and then for the patients as well, I think don't ever feel shy or embarrassed or that you wasted somebody's time by going to the emergency room, because a lot of times we don't know until we know. Like you're saying, it's worth getting checked out if you have a concern.
Yeah, I agree. Thanks.